Okay guys, so now we're going to be talking about PPE, or personal protective equipment. It's really important whenever you're taking care of your patients or residents that you know whether or not they're on isolation precautions. Clients can be on isolation precautions for various reasons. So again, it's important that you know what precaution they're on and for what particular microorganism they might be on. One of the first signs that might clue you in that they're on isolation precautions is they may have a caddy outside of their room, whether it's a yellow cart or a yellow sign. Every facility is a little bit different in how they display this. Through the Rochester Regional Health System, we actually use these um, yellow caddies here, and you can see they have disposable gowns and disposable gloves, and they also sometimes carry masks, goggles, rubber or booties that you can actually throw away. So it depends on what the patient is actually on precautions for at that time. There also is, right in the front of the caddy, signs that notify you that the patient has that they need particular type of isolation. In this case, this is contact precautions. And you can see, and when you come into lab, I'll show you a little bit clearer, you can see here it tells you exactly what you need to put on in order to care for this person, as opposed to somebody who might be on droplet precautions. For a microorganism like the flu, we would then have to wear a mask and have the appropriate standard precautions, and it would tell you that on the sign as well. Airborne precautions would be patients like your tuberculosis patients, and these require a special mask, and you have to be fit tested for that. So you guys will not be taking care of patients that are TB positive. And then you may see this last one here. This last one means that the patient actually, you're going to gown and glove up in order to protect the patient because their white blood cells may be very low and we don't want them to get an infection. So visitors may also have to follow that sign as well. So you can look at these as you come into the lab. These signs will actually be in the front of the isolation cart. So it will sit right here. And so when you go into the room, that'll be right there for you to visualize. So make sure you take a peek at that. Certainly in report, you need to ask your nurse that's reporting off to you what type of microorganism the patient has and where it's isolated at. Okay, so to put on the personal protective equipment, there isn't any particular order, although we often start with the gown. So you're going to take the gown off. It's really important to note at this time that you're not to be in the room, you need to be at the door. Often in facilities there may be a line that lets you know that you're not to cross that line until you have your personal protective equipment on first. What I find the easiest to do is to go ahead and tie the top and then place it over my head. I think that usually works out a little bit better for me, you know, because then my hair doesn't get in the way, and so that kind of works out better for me. So you may want to utilize that. Just make sure you tie it tight enough that it's covering your shoulders. At this point, the most common mistake people make is they have a gap between their glove and their isolation sleeve, and there should be no gaps because we don't want any microorganisms on our arms. So at this time, we always recommend that you take your thumb and sort of pop it through and you create like a glove. That way when you do put your gloves on, it will slide right over this cuff and you'll be completely covered. So I'm going to do that with the other hand as well. And I'm completely covered once my gloves go on. This last pair of ties here also needs to be tied behind you. So it's important that you get the gown fully around you as far as you can. And then you tie the ties. Remember, this is to protect you as well as to protect the patients. So you need to be fully covered and make sure that you have everything on the appropriate way. The next thing that I would put on is my mask. Now you might not always wear a mask. Again, it depends on the patient. In a contact room, you definitely have to wear a gown and gloves. But if we were doing some sort of procedure where you had the chance of having secretions come spit up onto your face or splash up onto your face, you need to make sure you're wearing mask and goggles. So this has sort of a little memory bend into it, and that's the side that's going to go up and around towards the crown of your head. And don't worry if it's kind of inching up towards your eyes, because you're going to pull it down. You're going to adjust that memory piece there, and you're going to go ahead and tie the back. So you're always going to tie the top and then the bottom. Here. And then I will go ahead and put my goggles on. Last, I'm going to put my gloves on. So gloves are, again, right down in the bottom of the caddy. So I'm just going to choose my size, which is medium. Put it over my fake glove that I made, making sure everything in the cuff is tucked in. And there we are. We are now fully garbed, fully gowned. We can now go into the room and do whatever we need to do with the patient. So when you finally are done with the patient, it's really important you take all of this off before you come out of the room. That's one of the biggest mistakes that people make, is they come out of the room and they bring all those microorganisms with them out into the hallway. So we need to take those off, again, before we reach that line, and hopefully there's some sort of trash receptacle towards the door, so you shouldn't be going back into the room once you take your gown, once you take your personal protective equipment off. So make sure there's a garbage can in reach near the door. So this does have to go in a particular order, and it goes from dirty to clean. So you want to take your dirtiest thing off first, right? Because it has all the microorganisms on it, and we don't want to be touching all over us. So we know if we just went in and touched a patient's wound, or we cleaned a patient's excrement up, we would then take the dirtiest part of us, which is always going to be your hands. So we're going to take that off first, remembering to take it off appropriately by pinching and scooping. The next dirtiest thing, believe it or not, is going to be our goggles. So we're going to take that off next by grasping just the sides. We don't want to touch the front, so just the earpieces, and we're going to dispose of that. The next dirtiest thing is going to be our gown. So we want to reach back, grab the tie, and undo it. You'll see a lot of people rip this, It's not recommended to do that because if I rip it, I'm flinging stuff everywhere and I'm not really taking it off appropriately. Chances of it to get on me or somebody else. So then you want to actually reach in. So you're going to take your dominant hand and you're going to reach in and you're going to roll it forward. Excuse my hair for being in the way. So you're rolling it onto itself. So you're never touching it or flinging those microorganisms into the air. Throw it away. Last but not least is going to be your mask. And you always want to take the bottom tie off first. Because if I were to take the top tie off, it would then flip back and onto my clothes. And I don't want that to happen. So I'm going to do the bottom tie first. And then the top tie. Handling it by the ties. I'm going to throw it out. Wash my hands. Remember, if you take care of a C. difficile patient, you need to wash with soap and water. And then I'm ready to come out into the hallway. So that needs to be done, you know, before that line there. You need to make sure you take everything off and dispose of it. And that's it to personal protective equipment.